Hello, I hope we're live and I hope you can hear me. This is Dr. Susan Wilder, and this is our very first Facebook Live experience from the office during this crazy time of COVID. I welcome you here, and what we're going to do actually is start the way that Dana and I start every single day, and that is with a little meditation. So I'm going to have Dana go ahead and turn that on for us, because we all need to take a moment to take a breath, to reflect on what we're grateful for, and to be treasuring our health and helping our immune system by managing our stress.
We practice, and when thinking's sticky, which it often is, you keep getting sucked back into the same narrative, your top 10 hits, you know how it goes. When it's sticky, how we can use the acronym RAIN to reestablish an embodied presence. And as a reminder, that means you just recognize what's going on. Okay, worrying, allow, give space for the life that's here. Just give space. Don't judge yourself for thinking. Then investigate, R-A-I, investigate in the body. And just to say again, I like to keep repeating this. Investigate for some people means think about it. That's not what it means in this. In RAIN, it means investigate in an embodied way. Find out, where do you feel it in your body? Is it pressure? Is there a sense of squeeze? Is there a sense of flow? What is it like in your body? Investigate. The N of RAIN, and the version that I've been teaching much more recently, is to nourish with kindness, with compassion, which means whatever you find, and often it's vulnerable or raw, to bring a quality of kindness to that. After you've done the steps of RAIN, recognizing and allowing and investigating, which means really contacting and nourishing, then just to rest in your immediate experience. And there's, in that resting, you'll notice what's called non-identification. That after doing RAIN, you're not so identified with what's going on. More, there's a resting in a wakefulness, an openness that's free. It can be a matter of degree, but that's the fruit of RAIN. So don't just do RAIN and miss out on the fruit. Like if the rain falls and new plants come up, just rest and discover the new growth, the flowering. So we practice for a moment. Just let's try it out and sense how we can become more embodied with RAIN, and then we'll move on. As you pause right now to practice, I'd like you to bring up something that happened today or yesterday or within the last few days that was slightly stressful, that got you thinking, got you activated, but not something supercharged. It won't be useful right now to do something supercharged. Something that brought up sticky thinking, irritation, anxiety. Might be something in a conversation with somebody, something at work, something going on with your health. Something that's around the corner that you're anxious about. Any situation that's a little sticky or tense will do. Take a moment to, again, reflect on it, think about it, remember it. The R is just to recognize, okay, this is what's going on. Stressful situation, thinking about it. The A is to allow, just to create some space, that you're not trying to fix anything. You're not trying to make the stress go away. You're just allowing the situation to be there in your heart, body, mind. And then to investigate is to deepen your attention and just notice, well, how's it living in my body? With some curiosity. When I'm in this situation, when I'm activated, what's it like in my body? And scan the throat, the chest, the belly. Just come into your body. It helps to use a breath, a slow, longer breath, breathing in and out and feeling the breath that in your body, just to stabilize your attention in your body. Then use your breath. Investigate. What's it like? And even if you're not sure if how it feels right now is related to the situation, what matters is investigating, how is your body right now? What's going on right here? The N of rain, to nurture, is just to regard with kindness whatever you're noticing. You might nurture just with a sense of acceptance, warmth, gentleness. Some gesture of kindness. And then we pause after the active steps of rain just to sense the fruit, whatever it is, without expectation, just to sense the quality of presence that's here. Just to notice what it's like, to rest in it. So sometimes when we're lost in thought or in a virtual reality, the coming home into the body is simple. We just go, oh, okay, I'm out there, and you just feel your breath and you come back in. And sometimes if it's stickier, as we just did, you'll recognize and allow what's going on and then investigate on purpose. Really bring your attention to scan down through your body and feel from the inside out. And on purpose, offer a gesture of kindness and discover how much more awake and present you are when you've taken those steps and deepened your attention.
All right. Well, I hope that just gave you a tool, the RAIN tool, for dealing with stressful emotions. You know, we're all dealing with a tremendous amount of stress right now. And the important thing is that we, attend to it, that we recognize it, that ideally we don't take it out on each other. And sorry, honey, I know I do that at times. My staff here are very well trained with the term, Dr. Wilder, would you like some chocolate? That's my clue that maybe the stress is getting a little bit too much, and then I need to get mindful and pay attention to it. It's okay to feel anxious, and it's okay to feel angry and confused and upset. And that's why we're here to do this today, and that's why we're here for all our patients all the time, because we realize, this is a process, and it's a process for all of us to work through it. And what we really want to focus on is that we have so much power individually, and we have so much power collectively to put a halt to this. And I just want to read something that I think we posted, that my husband wrote a couple days ago. about the power that we carry with this, and many are still having a hard time understanding why I should have to, isolate myself, and why I can't be going out and going to work and that kind of thing. And yeah, we're all taking a financial hit as well. But what Bob wrote, I think, was so beautifully put it, was consider the power of the geometric sequence. 1 gives rise to 2, which gives rise to 4, 8, 16, and so on. How the simple exponential function y equals y 0 times m to the x provides a virus, an organism neither living nor dead, indeed a molecular zombie, with the near mystical ability to wreak global havoc. Now consider our own ability to use that power, how it gives each of us, from the weakest to the strongest, the capacity to effect change. I quarantine, breaking a link in the chain of infection, and thereby keeping 2 others from becoming ill. They do the same and keep 4 others safe, who then follow suit. The same progression that allows a virus to spread with extraordinary haste is also the key to its undoing. It is a power that grants each of us, through little more than inconvenience, the ability to save the lives and livelihoods of countless individuals. At some point, most of us were asked, if you had unlimited power, strength, money, knowledge, what would you do with it? Well, today you are being told that you have that kind of power, the power of physical separation and simple math, the power to grant life or condemn to death. What will you do with it? So here today, we're really wanting to answer your questions. I will start with a couple that I've been hearing with great frequency, and we've tried to answer as many of them as possible in the handouts and information pieces that we've been disseminating. Number one, people are asking, how long is this going to last? How long do I need to keep my business shuttered? How long do we need to keep isolating? I'm bored out of my mind. My children are driving me crazy. And the question is, we don't know. But it will pass. This won't necessarily be forever, this level of isolation, although this virus may be with us for a long time. And to make the proper public policies on how long we need to separate and how long we really need to shut down and hunker down our businesses really requires data that unfortunately we're not going to have in this country right now, because our testing capability has been so impaired. So without the ability to test people and understand the true frequency of this virus, we have no idea really what we're dealing with. So we're flying blind without navigation tools. And that is a huge problem that we're facing right now. I will tell you that in Arizona, just from what I know is going on in the hospitals, that cases are starting to stack up, and we're on the exponential increase phase of the virus. So we're maybe 3 to 4 weeks behind New York, and watching with terror what's happening in New York. Now, many things that keep Arizona safer than New York, probably not nearly as dense population. We've had more lead time to learn the lessons of Italy and New York, so hopefully we are all taking this very seriously and taking the social isolation extremely seriously, particularly for our high-risk patients. And that includes many of us. I mean, 3 out of 4 of my physicians have asthma, and 3 out of 4 of our medical assistants are high risk for this disease. So A lot of people you think walking around are young and healthy have asthma or have maybe a heart disease or are on immune suppressing medication and that kind of thing. So, we have to think about this. Not every man for himself. It's the power of all for one for all, that we take care of each other. Do we have any questions coming through from the community?
Not so far.
So I'll answer the other question I'm getting a lot is, why can I be tested to see if I have the virus, even if I have no symptoms? And we hear about people out there, NBA players and senators and various people who are being tested without any symptoms. Well, unfortunately, at the community level, there is not enough testing. We've had, and we had our first case in Arizona in January. We've been asking the health department for weeks and weeks and weeks for testing capabilities. We decided as a nation not to use the World Health Organization's test kits. We were concerned, I believe, from one of the senator's offices, we were concerned about the accuracy of these tests or the sensitivity of the tests. So we decided to do it on our own, and unfortunately that has been impaired for a number of reasons, mostly supply chain reasons. Inappropriate, the initial tests that rolled out were not good. They just didn't work. The testing that's rolled out subsequently has been so limited in a variety of different supply issues. The collection swabs that are produced in Italy have been in short supply. Reagents are in short supply. There are 28,000 samples waiting at Quest Labs to be processed or in the process of being run in California. So those are from over a week ago, some of our patients included. And then there's several problems with the testing. Number one, we don't know the accuracy of any of the tests from the 2,000 labs that are supposedly working on tests in the United States. We have no idea how accurate they really are. We are hearing about home tests and that many of those may be scams. We do know that the tests that we have from our major facilities like Quest are probably very good at ruling in COVID. So if you test positive, that's likely to be a true positive, but they are not good at ruling it out. So a negative test may have upwards of a 25 to 35% chance of being false negative. So a negative test should not reassure you. The bottom line is that if you have symptoms that might be of a COVID nature, you presume you have COVID and you isolate. There's no two ways around it. And now Kara Christ from the Maricopa County Health Department tells us that primary care practices should not be testing at all. We should just treat all patients presumptively as if they have COVID. The other problem with testing is that every time we test, we use a critically low in supply personal protective equipment. I'm hearing some urgent cares are using 4 sets of personal protective equipment to see one outpatient with possible COVID. And meanwhile, the emergency rooms and the ICU providers are having to reuse N95 masks. That sterilization is really a challenging thing. So if you're reusing the same mask patient after patient after patient in the hospital, imagine the infection risk from what's being carried on that mask from patient to patient. And healthcare workers are getting this disease at far higher rates than the normal population, and they're have far higher mortality rates just because of the volume of exposure, and probably a lot to do with the stress and the lack of sleep and a lot of the other factors that affect your immune system. So any other questions?
Yes. I heard that taking more vitamin C at this time was helpful for prevention. Is that correct?
There's the data on vitamin C are iffy. Certainly is probably not harmful, but I would say megadosing on vitamin C, there isn't any great data for this particular infection that's going to be beneficial. just on the supplement line in general, we really believe in food first. If you are following a nutritionally dense, whole food, plant-based diet, getting plenty of sleep, managing stress in healthy ways, such as a daily meditation or prayer or meditative exercise like yoga, some kind of process, and getting moving every day, those 4 things, and washing your hands by itself, are going to drop your risk of infection so dramatically. And throwing a bunch of supplements in there is not necessarily going to add anything to that equation. And there are some things that are questionable. Mega dosing vitamin D is very questionable. Vitamin A, for sure, I would not recommend it. Even elderberry, even melatonin, there are concerns that some of these supplements upregulate what's called the ACE receptors in the lungs, which is where these viruses attach, and that we should be really cautious about dispensing anything that, one, has toxicity risk, and mega dosing of vitamin D and vitamin A absolutely have toxicity risk, or anything that could upregulate those ACE receptors. So we're very, very cautious about supplementation.
Hand washing, is liquid soap better than bar soap?
Actually, there's no difference in what soap matters. In fact, probably the plainer soaps are a little bit safer from the chemical exposure, and simplicity standpoint. What's important with hand washing is more the duration, that you get that good 20 seconds, and 20 seconds of vigorous friction. And that same is true if you're using hand sanitizer. Just slathering it on isn't going to help as much as rubbing it in for a good 20 seconds, so you get that virus really rubbed off your hands. And it doesn't really matter what soap. I certainly would not recommend an antibacterial soap or anything with triclosan, because those are harmful to our microbiome, which are our intrinsic immune support and detoxification team that we really need to keep healthy. Other question?
Yes. What are best practices to safeguard groceries coming into the house, as well as packages shipped at the front door?
Right. So yeah, the most recent studies, I think it was in Lancet or New England Journal, I can't even remember now, we're so overwhelmed with the research, but showed that cardboard is one of the places where the virus can live for up to 48 hours. So there are a couple things that you can do to mitigate that risk, and I would say consider that risk with every Starbucks you get from a drive-through, or every fast food packaging that people are picking up, or food that you're picking up, or your mail, Amazon packages, of course. Probably the safest thing, particularly for people who are at high risk, would be to have a staging area in your home where you bring those things, and either, if they can be left there for a couple days, or left out in the sun for a couple days, even better, then you handle the package. That would be fine. You could take a wipe or dilute bleach solution or alcohol solution and spray down the package and open it. You could open with gloves and then discard the gloves, and anything that you open or unpack or put away, just wash afterwards. I mean, I couldn't open my phone the other day, and I told my daughter, I think I washed my fingerprints right off. I don't think I have any left anymore. But and the same is true whenever you're out in any, if you have to make a run to a grocery store or go to a bank, God forbid, touching any kind of pad or anything like that, you want to be wiping down with hand sanitizer or alcohol, or dilute bleach solution.
So far, that's it.
Okay. I'm trying to think of other things that we're hearing from people. We have fielded a ton of people's questions about use of having medications like chloroquine or hydroxychloroquine or Zithromax, and unfortunately, I think these have been irresponsibly thrown out there in the community as if these are done deal good ideas for anybody to take. These medicines are not low risk. The antibiotics, Zithromax, really can nuke your microbiome, which is your again, your heart of your immune system. Really, really critical to have a healthy gut microbiome. And two, about 1 in 3,000 of us have genetic defects that put us at risk of something called prolonged QT, where taking these medications, particularly in combination, because both Zithromax and chloroquine or hydroxychloroquine are QT prolonging, the side effect you could get is instant cardiac death. Okay, that's not an acceptable side effect. And then there are other genetic issues with how patients metabolize these drugs that could also put them at risk. So never should anybody be hoarding these things at home, because patients who need them with connective tissue disease, rheumatologic disease, are unable to get them. Never should they be used outside of a physician's direct supervision with EKG monitoring potentially, and extreme caution, or at least knowing your genetics.
Some questions here about, is it safe to order food from a restaurant or commercial environment and bring it home for consumption?
Having just done that myself, again, everything we do, we have to think about the risk. So everything we bring into the home from the outside carries with it everyone who has touched that in its production. So by far and away, the safest thing to do is to prepare meals within your own home. And I think, some of the bright sides of this whole issue have been helping people slow down and slow their pace and just breathe a little bit and relax. I'm hearing all kinds of patients telling me how much better they're sleeping, and except those of us who are up all night worrying about things, and that we're all cooking and eating at home more often, which I think overall is a really healthy thing. If you just need to eat out, or it's just really cumbersome, or just because you need a change of pace, I would just be very, very cautious to bring in things that you wipe down every container. You can also reheat everything to make sure it's heated to a high temperature, so that you so if there's any potential contamination in how that was prepared, that's being dealt with. You can also ask your favorite restaurants what they're doing. I notice what the restaurants are doing in terms of their contamination procedures. When they come out and they deliver things, and they're gloved and they're masked, and they're being cautious, I can tell that this is a facility that's taking this seriously. But we do want to support our local facilities and our local restaurants as well. So balance that. Again, for very high risk patients, anyone older than 65 or with chronic medical issues, I'd be super cautious about it.
What are your thoughts on UV light for disinfecting or sanitizing packages? So
I just don't know what level of UV light. My husband and I were just talking about this morning. What level of UV light is going to work for disinfection? I have not reviewed all of that literature. We actually did in our office for our clean rooms, where we're seeing patients who may have the COVID virus. We've installed air filtration systems that also have UV disinfecting capability, but I don't know enough of the science to understand that. And I know who asked that, and I know he will do some of the research for me. So thank you very much in advance.
Yes. I heard that there may be a shortage of asthma inhalers. Is that true?
I have not heard of a shortage of asthma inhalers. I mean, we did recommend back several weeks ago to our asthmatic patients to consider, making sure your meds are filled and that you have it available. I've really not heard of any problem. A couple concerns specific to asthma, though, I will note. One is that the use of steroids for asthma, inhaled steroids for asthma, not so much the nasal steroids, but inhaled steroids for asthma or injectable steroids or oral steroids may really increase the risk of morbidity should you contract the COVID. So if you need inhaled steroids, then I really consider that a higher risk factor, and you want to be more careful. And then there is one supplement that I would recommend all asthmatics consider being on, and that is N-acetylcysteine. NAC is a precursor of glutathione, is a very potent antioxidant, but it is also a medication that strengthens the surfactant capability. We call it mucormyst is the other name for N-acetylcysteine. Strengthens that capacity in the lungs, which are the cells that get attacked first in COVID, are the surfactant producing cells. So NAC, I think, is a very reasonable, safe, and good idea supplement for anyone with asthma to take. And available, widely available.
Yeah. What changes are you making at Lifescape? How are you personally dealing with this?
Oh, wow. We've been preparing, of course, since January, and our team has been so amazing in, sourcing products, in doing intensive research, both on the nutritional front, on the medical front. We're following the high-level recommendations from Mass General, London. I have patients in Japan, China. We're getting input from all over the globe. Our medical assistants deserve hazard pay for the work that they're doing. In the military, that's what we would call when you go into a hostile situation at work every day, you get hazard pay. Well, that's what healthcare workers are doing every day. And they've just done a brilliant job, really, shifting our infection control policies to the nth degree. Actually, I think our infectious disease team who works out of our office are just following our protocols, because we've kind of done everything and it's all evidence-based. In my family, I have to say I tend to be the more cavalier one, and my husband is the one that's gently nudging me and reminding me what I should be doing to take care of myself. And I practice. I think we're all practicing what we preach. Again, about those 4 pillars of nutrient-dense diets, and the more stress you're under, the more you need to eat healthfully. Not that we tend to want to go to those comfort foods, but the more you need to eat healthfully. Exercising and meditating. I think Dana and I are both meditating at least 3 times a day now. Yes. Kind of up to the meditation level and I think that the final most important thing is humor, because laughter really is the best medicine, and this has brought out a lot of fun and creative things that people have shared, and that I think that keeps us going every day. You will see us in the next few weeks, because we are about to see our surge in Arizona, probably in the next 2 to 3 weeks. We are going to scale down our in-office presence to just skeleton crew. Of course, we're always available online, virtually, to all our patients all the time, and our nutritionist, as Dana has been extra busy, because not only as a health coach and nutritionist, that's really, really critical now, and people have the time to deal with it, but also some are referring her to friends and family members who just want a consultation for just boosting their immune function, because again, 90% of what you can do to boost your immune function is nutritional. So
yes. Many retirees in the golf club communities continue to play golf and tennis, thinking it is safe. Please comment.
Again, we're balancing we have to balance the physical health and the mental health of our communities. Golf, I believe it is possible to appropriately physically distance and play golf. So we live on a golf course. People who are golfing are required to be in separate carts or walking, and for the most part, they seem to be attending to appropriate physical distancing. We don't call it social distancing. One of our patients most appropriately said, we want to maintain physical distance and social connection. So I like that term so much better. Or I think my husband says, stay apart but stay together. So golf, I think it is possible to play golf and appropriately physically distance yourself or stay enough isolated where the risk of transmission is small. Again, I remind people that every single thing you touch, that golf cart, that side of the golf cart, a ball, if you touch a pin, if you touch a towel, so that's you have to consider that. Tennis is a different story. I had a patient who is a very, very avid player and didn't think about the fact that the ball is a fomite that could harbor a virus for fabrics for even longer than cardboard surfaces. So that is a harder one unless you're out there hitting your own balls against a backboard. I think that's really difficult.
What can we do as patients to help support the Lifescape team?
Oh, that is so sweet. Thank you. You know what? I think the most important thing is to do what we're telling everybody to do. Take care of yourself. Stay isolated. Know that this isn't forever. This is a short-term thing. I am emphasizing to the community that anyone who has particularly N95 masks, the ones that are so critical to health providers, these are being rationed in the emergency rooms and intensive care units and the people that are trying to save our lives. And we need to get those to the people that need them. So if anyone knows anyone who might have extras of those that we don't need because we should be staying at home, please either drop them with us or drop them with a fire department nearby, police department, or emergency room so that they get to the hands of people who need them.
After washing your hands properly, is it okay to dry them on a fabric towel or to use that towel over and over again?
Well, again, I think it's in your home versus somewhere else. So if it's in your home and there's no one else touching that towel, I think it's okay to use a towel repeatedly for a few days. I certainly am recommending heightening our frequency of laundering things. I won't wear a single thing more than once anymore. Other times I might have done that, but and we're going to all providers here will be wearing scrubs that we keep in the office and take home and launder every day and not wear anything from work back home. In a public place, I would just allow your hands to air dry. In fact, air drying is a little bit better than even using a paper towel to dry your hands, although the paper towel has the nice advantage of you can use that to open a doorknob to get out of the bathroom or what have you. But yeah, I would not use a public towel at all, period. and at home, just launder a lot more frequently.
Can you speak to seasonality?
This is one of the unknowns with COVID virus. It does not appear that warm weather reduces the transmission. Singapore and I think Australia had pretty significant COVID surges in spite of being warm weather. So I don't think that there's a whole lot of seasonality to this. And, again, the one powerful thing that we could do, if we shut this country down for 3 to 4 weeks, we could probably shut this virus down. I don't think that's likely to happen or probably realistic. But the more we shut it down, the more likely we can at least have this get down to a manageable level where the healthcare systems won't be overwhelmed.
What are the percent of people that would potentially be infected with COVID to have the need for a hospital?
I'm not sure I'm understanding the question, but the stats are changing constantly, and then we don't have good stats because we're not testing, so we really don't know our percentage, what our denominator is of number of people infected. But from the American Hospital Association estimates was that upwards of 30 to 40% of our population can expect to become infected. This is a brand new virus and we have no immunity. 80% will have mild cases, and by mild I still mean pneumonia. It can be very severe or it can be asymptomatic. And that's the other scary thing, that there are people out there asymptomatic that could be spreading this without knowing it. Which is again why we need to all hunker down and socially isolate, physically isolate. Mm-hmm. The estimates were that upwards of 5 to 15% might require hospitalization, and up to 5% require intensive care unit and ventilator. And the issues being in New York and Italy, we've seen it repeatedly, that there aren't enough ventilators. Again, with months and months of lead time, we have not figured out how to scale up production of testing, personal protective equipment, or ventilator capacity. And I'm not really comprehending why in this country, with the resources we have available, that has not been possible. But we don't have the ventilators, and when we don't have the ventilators, intensive care unit doctors are forced to make the decision of who gets one and who dies, and that is a really horrific position for any physician to ever be in.
Mm-hmm. Do you believe this virus is airborne or just transmitted via droplets?
I believe that the vast majority of the transmission for COVID, from what we know so far, appears to be droplets. So the cough, the sneeze, and then the particles that land on surfaces, and we pick it up from surfaces. However, certain procedures, including nebulizer treatments for asthma, can aerosolize the virus. So again, this may be one of the reasons why healthcare workers are getting sick at such high rates, are those respiratory technicians, nurses doing suctioning on patients on ventilators, doing nebulizer treatments on those patients, are probably getting exposed to much more airborne particulate than we understood. We also know from some of the cruise ship unfortunate experiences is that there is fecal oral spread, meaning and flu doesn't have this. COVID hits the GI tract and can get spread through the feces. So just flushing a toilet and the particulates that get sprayed as a toilet gets flushed could actually be a potential another way for patients to contract the virus. And a really scary fact was that virus was isolated from the Diamond Princess, I believe, 17 days after all of the people on board were debarked. So, this virus could survive on certain surfaces an awfully long time in the right conditions.
What about immunity and reinfection?
We are very hopeful that immunity is lasting after infection. It does appear to be the case in non-human primates, but we don't know for sure in humans, and we don't, again, have ability to test yet for COVID antibodies to show that somebody is COVID, immune. I know those tests have to be developed because they have to be using them in the vaccine trials, but they're not clinically available yet. But that will be very, very valuable. And some of the most exciting research that I think is far more likely to be expedient and useful in the very near future versus waiting out a vaccine, which is likely to take over a year. And very difficult with these viruses to create a vaccine. We didn't succeed with SARS or MERS or any of the other coronaviruses, and we've had years to work on this. But the exciting research is on use of convalescent sera. So if you can take blood from a person who's had COVID-19, isolate the antibodies, and then re-inject them into a severe case, or potentially even re-inject small quantities every couple of weeks into very high-risk healthcare or first responders to prevent, to keep them somewhat immune. It's like the old gamma globulin in a way. We'd have to require the blood banks. The blood banks are getting geared up to do this, but they're still waiting on the research protocols and some kind of directives from on high. So, but I think that's super exciting and hopeful.
Mm-hmm. Could someone use a sleep apnea mask in place of a ventilator in an emergency?
I think that's a really exciting potential, and certainly a lot of people out there have sleep apnea and sleep apnea machines, and I think there have been some case reports where I think even nurses have repurposed them to try to take the place of a ventilator. I don't know the science of how that might work. We've communicated with companies that do home ventilator management and the ability to rent ventilators at home, but it's certainly not as good, but it certainly might be better than nothing. So that's another area that a lot of people are definitely looking at.
Just a clarification on handling feces transmission,
Mm-hmm.
The procedure you recommend for avoiding that.
So I should have said, the steps that we've taken, just even in the clinic and at home, are number one, putting a chlorine tab, like a Clorox tablet, in the tank so that the water is a little bit hyperchlorinated, and then close the lid before flushing. And just try to be as far away from the toilet as possible if you can when you flush. That's not always possible, but and again, stay home so you're less likely to be in a situation where there's a toilet without a lid or not in the best of sanitary conditions.
That's it so far.
That's it. I think we are. What time is it?
11:20.
Oh my goodness. Wow, you guys have hung out with us for a really long time. Thank you so much. We are going to do this every week, and with one of our different providers. We're all researching different things, and we're all learning from each other. Thank you so much for tuning in. Thank you so much for great questions. Thank you so much for all the patients who've helped us reach public leaders, get in and get to the emails of senators and very high-level government officials who have given us hope with some of the creative approaches that some of our hospital systems are taking, that have helped us with clinical research to really make sure that we know the best and the brightest ways to take care of each other. And most of all, I just want to leave everybody with hope. We have tremendous power, and as I always say, most of the problems in this country are attributed to we the people, but we the people are the solution to the problems in this country. And this gives us the opportunity to choose. Either we can choose to be every man for himself, or we can choose to be all for one, one for all. And I'm really seeing the power of unity and coming together and taking care of each other, reaching out to those people who are alone or scared. I mean, some of our elderly are literally hostage in their homes. They cannot leave. They cannot have visitors. So I can't emphasize enough to reach out, take care of each other, and take care of you. And I'm just going to end with a beautiful quote by Anne Lamott that says, "Almost everything will work again if you unplug it for a few minutes, including you." So have fun unplugging, take care, and see you next week.